Assalamu alaikum and welcome to the Dr. UUT channel. In this video, we will talk about the calcium channel blockers as an antihypertensive. Well, the lecture is available in Urdu, so now we'll commence the lecture in English. Calcium channel blockers, as the name indicates that these drugs are supposed to block the calcium channels, means through which the calcium is supposed to pass. So generally, we are studying it as an antihypertensive. So antihypertensives are like decreasing the blood pressure. So first of all, we must know a little bit background that how the blood pressure generates. The blood is pumped by the heart and it targets the arterioles. So the blood, when it comes or reaches the arterioles, the size of the arterioles, you know that it decreases. So when there is increased pumping of the heart and increased outflow of the blood from the heart towards the arterioles, so then it will generate a kind of pressure. It will exert, the blood will exert the pressure on the arterioles. Like this, the person will shift toward hypertension. So now how will we treat? Very simple. We can do two things. The first thing is that we have to dilate the arterioles. The second thing is that we have to slow down the contraction rate of the heart. So our targets, you can say, are these two. So calcium channel blockers, we will now find the calcium channels. You know, calcium is responsible to do the contraction. So in case of contraction, we will focus the arterioles, and in case of the contraction again for the heart, the very important thing is that calcium is responsible to generate the pace in the pacemaker cell. If you remember about the action potential generation, we have got the concepts in our last videos about the action potential. So when the action potential generates here, then what will happen? Then the signal will come through the conduction fibers, through to the contractile fibers, and then the contractile fibers will contract. Like this, the heart will contract. So we can stop or we can decrease the contractility of the heart by means of blocking the calcium channels in the myocardial fibers and in the sand. When we block these channels, then the action potential will slow down. As the action potential slows, so what will happen? Then the contraction will also decrease the contraction rate. And the next thing is that we will give the calcium channels blockers, and these calcium channel blockers also target the arterioles. And inside the cell, what happens? Like in the smooth muscles of the arterioles, the calcium is responsible to do the contraction. So what will happen once the calcium will enter the cell? Then it will forward, or it will ask the endoplasmic reticulum of the muscles and the mitochondria to release further calcium into the cytosol. So when we block this channel that is responsible to do the inflow of the calcium from outside to inside, so when we block this, what will happen? The calcium will not move in. There will be no any release of the calcium. And you know about the contraction rule of the calcium. We act in myosin filament when they are coming in the contraction. So calcium plays a very important role in the contraction. So when we block this, what will happen? The smooth muscles of the arterioles, they will no more contract. Why? Because calcium is not available. So in a sense that the arterioles will dilate. So we did now two things. We decreased the heart rate of the pumping mechanism, and we dilated the arterioles. So when the blood now is just coming towards the arterioles, now this blood will exert a very minute amount of pressure, means the pressure will decrease. Like this, we will gain the antihypertensive role of the calcium channel blockers. So we have, according to pharmacology, we have two types of calcium channel blockers, like non-dihydropyridines and dihydropyridines. And some books mention that there are three classes of the calcium channel blockers. Those are diphenylalkylamine, benzodiazepine, and dihydropyridine. So these are the three classes and two groups: non-dihydropyridines and dihydropyridine. According to the dihydro and non-dihydro, what is this? This is actually these names are given according to the chemical structure of the compound pyridine. So when the two hydrogens are available, it is dihydropyridine. Actually, this is not the exact structure, the chemical structure, but I'm mentioning the hydrogens here. If two hydrogens are available, then this compound is called dihydropyridine. If the hydrogens are not available, then that is called non-dihydropyridine. Non means no dihydro, two hydrogen available in the pyridine structure, then those drugs are called non-dihydropyridine. And if the two hydrogens are available, that's called dihydropyridine. And this class or this group is special and specific for the vessel or vasodilation, mainly arterioles. Nifedipine and philodipine are the drugs. And the very interesting point about this memorization is that you can understand and you can recognize the drug, if someone asks you or tells you about the drug name, that what is nifedipine used for, you can guess from the name. All the names end with the dipine. So when you hear the word dipine, the sound dipine at the end, so that indicates that these are the dihydropyridine, and these are special and specific for the arterial dilation. And we have the non-dihydropyridines, in which we have two classes: diphenylalkylamine and benzodiazepine. Diphenylalkylamine contains verapamil, and benzodiazepine contains the diltiazem, the very two important drugs. These drugs direct both the calcium channels, means they can block the calcium channels of the syan and muscle fibers, sinoatrial node, means the pacemaker cells and the contractile cells. So they can block the calcium channels in both of them, and as well as it can block the calcium channels of the smooth muscles of the arterioles. So they are specific for both the non-dihydropyridines, and dihydropyridines are specific only known for the arterioles. Then according to the patient, we will recognize the patient's condition, and according to that, then we will direct whether we will give the non-dihydropyridine or the dihydropyridine. So then it will become easy for us to match the drugs to the for a specific patient. Well, so this is the mechanism of action of the calcium channel blockers. Hope so you got. If still you have any kind of question regarding this, you can ask us in the comment box, and we will come for the answers very soon, inshallah. Thank you for watching.